Hello, I'm Dr. Paul, and today we're going to talk about IBS. So what exactly is IBS? IBS stands for Irritable Bowel Syndrome. According to traditional medicine, IBS is considered to be a functional bowel disorder. And what this means is that there's abnormal functioning of the GI tract, but all other test results come back negative or normal. These test results can include things like x-rays, CT scans, MRIs, ultrasounds, endoscopy, colonoscopy, stool tests, breath tests to rule out things like lactose intolerance and fructose intolerance, and SIBO, blood tests, and more. In other words, your bowels are irritated, but we don't know why. So what are the common symptoms of IBS? Common symptoms of IBS are abdominal pain, gas and bloating, and constipation and or diarrhea. So what causes IBS? Well, according to traditional medicine, it's considered to be idiopathic, which means we don't know what causes it. However, in functional medicine, we believe that there's a combination of causes that can potentially contribute to IBS depending on the individual person. Some of these factors include food allergies and food sensitivities, imbalance or dysbiosis of the microbiome from bacterial overgrowth, yeast, candida, or fungal overgrowth, parasitic overgrowth, low beneficial bacteria or probiotic status in the gut, infections, toxicity from environmental toxins, mold, heavy metals, chronic stress over time, dysfunctional brain-gut axis, which means poor communication from the brain to the gut, and more. So what tests are there for IBS in traditional medicine? There are no current tests for IBS. IBS is diagnosed through a history and then doing testing to rule out other conditions such as celiac disease and inflammatory bowel disease like ulcerative colitis and Crohn's disease. If these tests all come back negative or normal and we have the classic IBS symptoms, you're typically diagnosed with IBS. So what tests do we do in functional medicine for IBS? In functional medicine, we do a combination of testing depending on the individual case. The testing can include things like food allergy testing, food sensitivity testing, stool testing, toxicity testing like environmental toxins, mold testing, heavy metal toxicity testing, nutritional deficiencies testing, cortisol or adrenal testing, comprehensive blood tests, making sure things like blood sugar is optimal, inflammation is low, red and white blood cells are healthy, hormones are healthy, the immune system looks well balanced, etc. So what is our approach to IBS and how is it any different? To put it in simple terms, we break it down into two categories. Number one, what is negatively affecting the body, creating inflammation, and breaking the body down? This would be things like food allergies and food sensitivities, imbalance of the microbiome, whether it's a low beneficial bacteria, bacterial, yeast, fungal, candida, or parasitic overgrowths, other infections, toxicity, like I mentioned, from environmental toxins, mold, heavy metals, and chronic stress. We want to identify these factors by testing and removing anything that is negatively affecting the body. By doing this, we give our body the best chance to restore its own innate ability to repair itself. Number two, what is the body missing that can positively impact healing, recovery, and repair? These would be things like nutritional deficiencies, good beneficial flora or probiotics, etc. Again, we want to identify these things through testing and improve these levels as much as possible. Reminder, everyone is unique and different, which means the testing and test results will likely be different for everyone based on their own unique case. What can you do about IBS? Test and don't guess. By testing, you eliminate a lot of the guessing game, fine-tune your individual dietary needs, remove inflammatory triggers, and replenish what you are missing to help the body heal, recover, and repair. If you can't do the testing, then what do? Removing dietary triggers are huge, and it can be really tough to give general suggestions without testing. All I can tell you is that the most common dietary triggers in general for gut-related issues are grains and dairy. Outside of dietary changes, is there a supplement you can take? We suggest Glutacor. Glutacor is designed to promote the health and barrier function of the gastrointestinal lining. Its unique formula includes nutrients that support gut mucosal epithelium. The purpose of the epithelium is to allow the digestion and absorption of the dietary nutrients while keeping the unwanted toxins, microbes, and food particles from passing directly into the body. Glutacor includes a high dose of L-glutamine, which serves as nutrition for the gut lining. It also provides DGL and aloe vera extract, both of which protect and promote the health of the gut mucosa. There are two other ingredients, N-acetylglucosamine and zinc, which boost GI integrity. Well, I hope you learned a little bit about IBS today and what makes the functional medicine approach different from the traditional medical approach. Until next time, I'm Dr. Paul.